Welcome to this edition of Peak Performance Podcast with your host, Thor Conklin. Thor will be sharing the necessary tools, strategies, and psychology you'll need to become a peak performer in any area of your life or business.
Welcome back to another episode of the Peak Performance Podcast. I'm your host, Thor Conklin, and today we have Dr. Larry Williams, graduated from the University of Tennessee College of Dentistry in 1982. He also served 30 years in the United States Naval Dental Corps. He currently serves as Associate Professor at Midwestern University College of Dental Medicine. And the list goes on and on. If I sat here and read all of your accreditations and a bio, I think we'd be here for about an hour and a half. So, Doctor, thank you very much for joining us. I wanted to have you on the show today because we're just starting the beginning of the COVID virus. It affects dentistry, it affects everybody. But I wanted to specifically talk to you today about dentistry, how it affects the dental offices, how it affects the patients. And I've got some of my own thoughts as well, because what we're trying to do is make sure that we keep the general public as safe and as healthy as possible. And I think we can do both of those in dentistry. And right before we came on, you were kind enough to say, look, this is not my first rodeo. I've actually been through this before. So could you go into a little bit of detail of what your background is in public health?
Sure. Thank you. And it's a pleasure being here. And thanks for inviting me. I have a background in this because from 2006 to 2009, I was the public health emergency officer for Navy Region Midwest, and that covered 16 states, included Illinois and other states in the upper Midwest. And one of the things that we were responsible for was the only Navy Recruit Training Command, which is here in North Chicago. But from 2006, 2007 timeframe, that looked like the bird flu was going to come and pandemic flu outbreak. So we did a lot of training across the Midwest with both civilian and military hospitals and medical clinics. And then 2009 came along, the H1N1 flu outbreak, and I was in charge of that, and we lost no training days with the Navy Recruit Command. We kept the pipeline open to feed the fleet and keep us all safe. So it was quite a challenge, but this is sort of a repeat performance because, and if you don't learn from history, you're bound to repeat it. So we learned a lot then and made sure that the right and left hand were talking to each other. And I'm not going to go any further with that because we can see what happens when the right and left hand don't talk to each other. But we're making corrections, just like being at sea in a ship. You can steer a straight course, but you're going to have to look out for that lighthouse every now and then, or the oncoming ship, and sort of move around. So we're still in that mode.
Yeah, I guess, when this first started, I said, we're really tackling uncharted territories. Yes, we had the SARS, the swine flu, and others. But really, if you go back to right around the First World War and the Spanish flu, it's really interesting, as I started to do my research, that we've been here before. I mean, this is something very similar. It was a COVID virus back then. Yeah, go ahead.
Well, what I was going to tell you, that the biggest difference, though, was travel.
Yes.
And spontaneity of news, because those were the two big things lack of mask, lack of medical care, which, you figure 100 years difference, that's pretty significant. But still, at that time, it took 2 years for the virus to go around the world. It took 2 years. Here, it's not taking that long because, within just days, the virus was in the United States. The virus was in other countries because of the 12, 14-hour travel day from China to wherever, and then from there to other places. And it's the peak is reached much faster than it was before. And then in 1918, actually it's 1917 to 1919, somewhere in that area, 50 million people died at a minimum. That's best estimate. And they also, one of the things it's in the literature was that the World War I ended because there were not enough healthy soldiers to fight.
Yeah.
So pretty significant change but again, it repeats itself.
It does. It does. Hopefully this one doesn't end up mutating. And I wanted to talk to you specifically about the dental world. It's something that you've had extensive knowledge in. Many of my clients, I'm a coach and consultant, and many of my clients are dentists. And, this is a time where a lot of people go into reclusion. They kind of step back. They don't see kind of the light at the end of the tunnel. And while they're in it, they can very much become very restricted or stagnated. And I'm always looking for, okay, what are your clients or your patients ultimately need? What services can we provide? And how can we make this period, although it's going to be a difficult period, safe for you and for the patients, but also give you an opportunity to try to serve wherever you can. And one of the things I want to get your thought on this is, we know a strong immune system is something that will help us ward off the virus. If we may get it, but maybe the symptoms won't be as bad. But we'll certainly, the stronger immune system, hopefully the better chance that we have making it through and recovering. One of the things we know in dentistry is that, when the mouth is clean, you have regular hygiene visits, your body's not fighting those extra bacteria and things in the mouth. So one of the protocols that we implemented was to go back to our patient base and say, look, if you haven't been in for a while, come on in, get your teeth clean, and get that rotation on a quicker basis than it had been in the past. Thoughts on that?
Well, the one thing we don't want right now, and I'll just tell you, this is what's come up from the Illinois State Dental Society, the ADA as well. There's a shortage going on with PPE, personal protective equipment, and our ability to do standard precautions, masks, gloves, eye protection, gowns. If you don't have those or any part of those, you don't treat patients.
Yep.
And if we do routine care for a patient and waste our valuable resources because we just don't have enough right now, this is a national, actually it's an international shortage that's occurred, then there's a chance we won't be able to take care of people that really need the care, the emergent or urgent care patient that comes in. And then the other part of it is, and this is a plea that's come from the leadership in dentistry, is that if we have equipment, if we have supplies like masks and gloves and stuff, and we have limited our care to patients that only need urgent care, then there's a possibility we may be able to share those supplies, those needed supplies, with the hospitals, which are going to run out. When this curve, if you've seen some of the literature, and some of the news and everything from the CDC, and it shows different curves, depends on how much infection there is and how rampant it spreads. But if the curve goes like they think it's going to, we're going to max out our supplies and our bed space for patient care. And if that, in all honesty, if I had to choose between sharing my supplies with a hospital that needed to save lives by me cleaning teeth.
Yep. Good point.
You see where I'm going with that?
I do. Yeah, I had my consultant hat on for a moment, and I'm like, all right, let's take care of the patients to get them healthy. I was not factoring in the limited PPE.
And you're not a thing wrong with what you're saying in terms of healthy mouth, healthy mind, healthy body, all that's tied together. We know that there's a direct link between oral health care and diabetes. If you have good health care in your mouth and you're taking care of yourself, there's a chance that your glycemic levels will be good, your sugar in your body, and there's a less impact of diabetes on your body. But if your mouth is in bad shape, the diabetes is going to go rampant, and it's just like the dog chasing its tail. It's just going to get worse. Same thing with coronary disease, pneumonia even for older patients. If you have a lot of bacteria in your mouth, there's a potential for inhaling those bacteria into your lungs and creating a new bacterial infection.
And that's our biggest risk, is the pneumonia onset from this.
It is. As soon as my grandmother, I'm sure, I don't know if you've had relatives that have had that issue, but they've gone into the hospital to have stuff done and they got bedridden, got pneumonia, and that was it.
Yeah. My grandfather, I remember him telling me stories that he had two siblings that died in the 1919s, 1920 area, that there was this thing going around. I never knew it was the Spanish flu until I started researching it. It's exactly what it was. And they had died of pneumonia.
Yeah, it's a funny thing in a way, because it really wasn't the Spanish flu. It didn't come from Spain. It came from Asia at that time. But it got that name because of the press and some other journalism things that were going on at that time. But I thought it was ironic today. They talked about how it's starting to focus on Spain now having problems taking care of the COVID-19. And here it is that Italy's got more cases, but Spain is going to spike more than they did because of their open border situation, some things that are going on in the country. So they're going to get blamed again. But it shouldn't happen. It's just everybody's involved in this, and everybody needs to find a way to help. Appreciate the opportunity to talk to you about it, because dentistry is something we are in. I actually had another interview today, and I said, pardon the pun, but we're down in the mouth. We're always in the mouth, and the bacteria, the viruses, everything are right there.
Yeah.
And if we're not careful, we create an aerosol. That aerosol spreads 3 to 6 feet around us. And that can be significant if there's viruses in there.
Yeah.
And, we have to protect ourselves against hepatitis B, hepatitis C, other types of bacteria that can come along and causes problems. The flu, just the regular seasonal flu.
Yeah.
And that's why the masks are there. That's why I don't know if your folks know that, but you can get infected through your eyes.
Yeah.
The whites of your eyes, the conjunctiva can pick up.
Most have decided to eliminate the aerosol cleaning. Yeah. Because it sprays everything everywhere.
It does.
When do you think we're going to, and I know you're not leading the effort for the United States, but any word on as far as the supplies and when we should get more PPE?
PPE is coming. It's being resupplied. Some places had backlogged supplies, which was good. Because a rainy day can come at any time. Yeah. And you should be prepared. I'm a Eagle Scout. I can tell you that, preparedness is my way of life, and you make sure that you have things available, not hoarding.
Yeah, I get it. Yeah.
You should have enough to be able to get by. And so we're seeing, if you go to Amazon and look at Amazon, in fact, I was just on there a little bit ago looking at their website and checking to see when supplies were going to be coming in. Hand sanitizers becoming available. It's pricey. Masks are becoming available slowly but surely. And some of those are really gouged in price. But I think things will come back. Now, walking into one of the supermarkets and trying to find toilet paper, that's a totally different story right now. If you haven't done that, that's a real treat. Toilet paper.
I got it off of Amazon. I'm good on that one.
Okay, good for you.
My background, you're an Eagle Scout. I actually did scouting when I was younger. Did not get the Eagle Scout. Congratulations on that. It's an amazing organization. I used to sit on the board of the Boy Scouts. Great organization. But my degree is in risk management.
Okay.
So I'm always thinking, okay.
You're the same way.
Yeah, my mind just thinks it's like, what could go wrong? And unfortunately, my office was the World Trade Center. I lost 3 people on 9/11, and who would have ever thought about that? Had a flood in Lower Manhattan. Building was shut down on Friday. By Monday morning, I had an office up and running. Because I think that way. Things can go wrong. We're going to get through this, but always trying to prepare. And it's funny because I saw the onset of this happening. I actually had a client that self-quarantined, not for any reason other than he saw something coming 6 weeks ago. And what's very interesting, this is a very wealthy client that is not a conspiracist or panicker or hoarder. He's just a smart guy. And he said, something's not right here. And we thought he was crazy. Like, why are you staying at home 6 weeks ago? Well, guess what? He was on to something. So I had the opportunity to, try to get out in front of this and prepare people financially, and their families and their businesses. Let's talk about the dental offices for a moment. We find ourselves where we do today on the 15th of March or 16th of March.
16th, yeah.
I should know that because I'm doing 10 times the number of days. Whatever the day is, I'm doing push-ups times 10. So today I've got to get 160 push-ups in. So I was trying to make it a little less than it actually was. 16th of March. What does the dental office do today? How do they prepare for the next 4 weeks, 6 weeks? We're going to assume that the dental offices will remain open if they can during any sort of shutdown similar to Italy or Spain. That may or may not happen, but if they do stay open, what's your advice to them?
Well, and I have this firsthand because I'm picking this up from other people here in the Chicago area that are practicing. And for the most part, the patients are canceling, and rightfully so. They're either afraid or they just don't want to go out. They want to, and that's what the government's saying. Self isolate. Let's just slow down. Let's see if we can get this curve to stagnate or at least be minimal instead of skyrocketing. So people staying out of the dental office except for urgent care, that's all well and fine. Maybe you need to complete something. Maybe you have a temporary crown on your tooth that you need to get finished. You may have started something that needs to be completed. But for the most part, I think people on their own are being smart, and the dentists are going to have to, they can't force somebody to come in. And in all honesty, it might be better because you got all these things that's working not against you, but working at the same time. Schools are out. So single parents have to stay home with the kids. So they may be the dental assistant, male or female. They may be home with the kids and need to be home or having to get childcare. They could have an older relative that they need to go take care of. So there's a lot of stuff that happens. But in all honesty, when one door closes, you look at another one to open. Do you train? Do you look at some of the backlog of records that you need to look? There's a lot of things that can occur that can allow you to make good use of your time. And this situation right now, let people sort of stay home, relax. And again, what's nice about it? They're not using supplies up like they were. I don't mean it.
No.
It's the income. There's an income issue. I know the profitability and everything else that goes with it. But in all honesty, and I'm saying this, you're a risk manager and everything. You've got that background, but I'm also one. I've been, looking at work controls, administrative controls, everything else for risk management. It runs the gamut. But I'm going to go and tell you, live patients pay a lot more than dead ones do.
Yeah.
Okay. So when you look at your bottom line and somebody that's a dentist is concerned about not having patients there to treat, if they're at home and they're living and staying alive and working to protect themselves, we should do everything in our power to do that. Now, here in the Chicago area, we're asking people that may have slowed down their work or not have as much work to go and volunteer at the food bank. Go and volunteer to deliver medicine to the people that are homebound that can't get their medicine and don't, 70, 80-year-old person doesn't need to go to the pharmacy to get their meds.
Yeah.
So there's a lot of stuff we can do to help. We're not advertising our practice. We're just advertising our humanity.
Yeah.
Big
good point.
Yeah.
Also have a bunch of them working on really getting their systems, processes, procedures, with any business, you just kind of run, and then you kind of make things work as you go. But many are taking this opportunity to kind of step back, evaluate what they're doing, documented processes, create training videos for new team members, etc. My last question today is, all my dentists are scrambling begging, crying of trying to get people. And you're doing the great work of getting those people through the system. Are we going to get to the point where we fill the demand that's out there? They're looking for hygienists, they're looking for dental assistants. There seems, I don't know if it's because of our current job market, or is there a supply issue? Where's the constraint?
For dental schools, I will tell you, for dental schools, it's funny. There's some, people that are in the logistics side of the house looking at how many dentists are retiring. So how many dentists do we need to help take care of those practices that are going to be without a shepherd, so to speak? They're not going to have that dentist there. So we're looking at replacement there. We're also looking at some out-of-the-box thinking for public health clinics and loan repayment through public health clinics, like a federally qualified health center, FQHC. So those are out there. In terms of dental assistants, hygienists, things like that, I taught for almost 12 years of my 30 years, actually almost 40 years of practice. I taught part-time at a dental hygiene programs and helped teach the students, helped put that together. And they were all they're great people, and they're all very gainfully employed. Dental assistants, they don't grow on trees. They can be on the job training. They can be trained through a local, in programs at colleges and junior colleges and community colleges, associate's program or a certificate program. All of those things, they're coming along, but a lot of practices like to train their own, because if I can train somebody that's in my practice to assist me with doing implants, assist me with doing root canals, and making sure that I get a good quality person there, that's all well and fine, but what you've just done is make that person very valuable. And, they may have a lot of, feeling towards you, but if somebody else offers them an extra $5 an hour, you've got, so that kind of market's always going on. But you know what? That's the market. That's the way it is. And
are we attracting enough young men and women into the industry?
I'm sorry, I didn't.
Are we attracting enough young men and women into the industry?
I can't say we are or we aren't, because I look around and we're hiring people. People are being hired in practices, but you always hear about somebody that's aging out. They've been doing, been a great dental assistant for 25, 30 years, and they're tired. They'd like to go home and do something else. And then you've got to train somebody else, and you train them and get them up for a couple of months or 2 years, and then they go somewhere else. So I don't know if it's that we're attracting them. It's keeping them is the thing that we run into. And when you have a piece of gold, you'd like to hold on to it.
Yeah. Actually, I have one final question. That was supposed to be my final question, my last final question. When do you think we're going to be at the point where we've got some sort of machinery attached to the patient and the dentist is in the next room doing everything from joystick, computer, or something like that? When are we going to see that? I assume that I'm going to see that in my lifetime. Are we 10 years from that, or are we 50 years from that?
Robotic dental care, like robotic surgery, and in the general surgery table, I really don't see that happening, because it requires, now, if you can figure out a way to get the input of the dentist looking at that and watching what's going on and understanding.
Yeah, I'm saying actually running it. He's the one at the controls running it. Yes.
I can't see AI, artificial intelligence doing it, because they would have to learn so much and have to drill. But then again, the problem you run into is, unless the patient is sedated and not going to move, because dentists, we're trained to recognize. I'm trained to sit there and With robotic surgery, I'm going to be looking, you've got to look in the mouth. You've got to look where the drill's going. You're not looking at the patient's eyes. You're not watching their body movements and seeing where there might be something coming along that's going to cause a problem. There's a lot of interpretation that takes place. You may not realize it, but in terms of, from my viewpoint, there's a lot I get from watching the eyes, watching their motions, watching their, their hands. And, when you see the white knuckles grabbing the chair, you better have learned something. And a young dentist does learn that very quickly and learns how to, appreciate those things. Yeah. So I don't know that robotic dental care now, maybe placing an implant, and those are getting much more, predictable to where that could be done. But, for doing, an examination and doing a care that might require something, I just don't know. I don't see it happening.
So it's either not going to happen or it's a ways off. That was kind of the end. And, it's interesting that you said when you need to feel the patient, you need to see what they're doing, you need to see their eyes. And I do everything on video. And my clients, very often ask, why are we doing it on video? Because I said, I'm not listening to what you're saying. I'm listening to what your body is telling me.
That's right.
So that says a lot. Well, Dr. Williams, thank you very much for joining us today. I really appreciate it.
Well,
the very best to you and your family during this difficult time, but you've been here before, and we're going to make it through. So
thank you very much. Best to you.